highlight this in our report. Statewide, we have noticed a drastic decline in Child Protective Services referrals for investigation. I believe it's over 40% decrease. So we're just encouraging the public and mandated reporters to still be mindful of these things and call our office if they have any concerns for children or our elderly population. We are still open. We are an essential function in the county, and we encourage calls in the event that there's concerns about children in or adults in our community. At the end of his formal remarks yesterday, he again commented California's sacrifice in the spirit of cooperative and collaboration, and encouraged us to listen to our local health director. So they're working very hard to keep us posted on what's happening, and it's important for us to listen to them. Our data in the county, since our last board meeting here, our case count has increased by 8 in a week. And so we do currently have 8 active cases. We have 28 recovered. We expect the cases to increase today. Just a quick brief update on the non-essential business enforcement. We've had 22 businesses now to date that have been closed as non-essential. I didn't document exactly how many increased, but we are continuing to find businesses that are functioning and non-essential. So we are encouraging you, if you possibly are a non-essential business, to please contact our number if you have questions, or to please close your operations down. Some of the businesses were posted on the press last week, and so we will continue to pursue these businesses, as well as some social distancing complaints that we've been receiving. So we asked Dr. Marty, our health officer, and Dr. Bogie from Hazel Hawkins to be on the call to just talk a little bit about some of their thoughts. We have a couple of questions here highlighted for them. I know that Dr. Marty's on the call. Dr. Bogie, are you on the call?
I am. Both of us.
Great.
We're both on.
Okay, so if we can have Dr. Marty speak first. The first kind of question or thoughts that you may have on, are we seeing a flattening of the curve? Dr. Marty?
Thank you. Yes, actually, looking at our data, we have had 38 cases, and as I mentioned before, that maybe that doesn't sound like a lot, but because our population is pretty small compared to the other larger counties or states around us, our rate is still significantly competitive or high compared to other counties such as Santa Clara, especially, and we're higher than Santa Cruz or Monterey. So we, the issue has been from the beginning, which direction are we going? So I am very encouraged and happy with the progress that we're making with our shelter in place. And when I look at the data, as far as the direction of the curve, we are in a downward slope. So that's a good thing. It looks like we are flattening the curve. But why did that happen? And when you look at the date, it started happening the end of March. So through the influence of our shelter in place. So I have to commend the population for adhering, for the most part, to the orders. And so this trend is showing, again, in the direction that we wanted to see it. But as we know, if we let up on this too soon, we're going to see a second wave potentially. So basically, we have actively looked for cases and investigated those and looked for any contacts and quarantined all of those people. So again, we have some control over this right now. But if we open up too soon, and I think that's what the governors in the western states and in the east are looking at, how will we do this? It's not a switch which we can turn on and off. It was probably easier to close things down than it will be to open things up. And we can't do it all at once, that's for sure. So the state is going to begin to look at how to do that, and the local health officers in the region, the 11 or 12 of us, have been meeting. We had a first meeting on Saturday and began looking at what will be the process for opening things up. So we have to do that very strategically, and there's some assumptions that we have to make before we do that, and that is that our hospitals are able to handle any potential additional cases that we might generate as we open up. So we have to see that the hospital rates of admissions are dropping for a good few weeks. We also have make sure we have to have proper supplies of our personal protection equipment as we may need more of that. We have to definitely have better access to testing, because again, as the key will be, if we do find additional cases as we begin opening up, we have to quickly test them, isolate them, or quarantine any of the contacts that we've seen. So again, we're moving in a good direction. Overall, of our 38 cases, we admitted about 24% of those, or 9, had been to the hospital. And also, we were looking at. Remember, I had talked about being concerned with a lot of people that work outside the county and the influence of places like Santa Clara, especially. We had, in looking at our cases, 22 of our cases worked outside of the county, and about almost 3/4 of them in Santa Clara County. So there was a big influence from Santa Clara County. So we again have to work closely with the region to make sure that we're all in sync as we do this. And then we will be posting information on the ethnicity of our patients, and we had, of our 38 cases, about 18% white, 8% Asian, and 63% Hispanic. But remember that the population is about 59 or 60% Hispanic, actually 61% Hispanic. So we're basically appropriately seeing the cases in the population as the demographics of the county show. So that was to be expected. So so at this point, I would just say we're doing a good job. We need to continue doing this. The order is in place until May 3rd, but we will begin actively having discussions and coming up with a plan for beginning to open the county, but again, doing it very strategically so that we don't overwhelm our health system and that we also keep people as safe as we can. And more to come on those plans in the next couple weeks.
Thank you, Dr.
Thank you.
Marty. Dr. Bogie, do you want to comment on seeing a flattening of the curve?
Sure, yeah, Dr. Marty, I mean, he basically summed it up really nicely. I guess I'll just add a few things and I'll reiterate a few things. I think what he said about us, our percentage per our population, meaning, we only have 38 cases, it sounds great. However, when you factor in that we only have so many people in the county, we are actually worse than Santa Cruz and Monterey County in the sense of percentage-wise. So it's definitely affected us. Are we seeing a flattening of the curve? I think we are. I think that we should take that with a little bit of caution, though. When we're talking about this curve, there's different ways to talk about it. We should look at those models that we all see. We've probably all seen them. University of Washington's put them out, and we've seen these models. And those models are generally based off of 3 types of people. There's a susceptible person, an infected person, and a resistant person, or a person that's recovered. So when we're looking at the curve, we're mostly looking at infection rates, number of infections. What we're seeing now is those number of infections per day are flattening or decreasing. And we need to remember that as that curve is rising and we start to see those numbers dropping, that we're only halfway up the curve. So there's a shift in that parabola. It's going to change and hopefully start trending down. But if we lift our orders too soon, I think we run the risk of that curve continuing to rise again. So I really am a proponent of staying the course, at least for now. I think we're just now seeing that flattening. And if we lifted things too soon, we would just rise again. Now, I think what's going to happen is we're going to have to lift some of these conditions. Now, how that goes about will be above my pay grade, but I think, at least for the hospital, I think this is going to be around for a long time. I think we're going to be dealing with this for a very long time, and we'll be wearing the PPE, and so we'll need to make sure we have all of that stuff for a very long time. Let me see, what else did he talk about? Social distancing, has it helped us? I think it has. I think the county did a great job. And let's see, will there be a switch? I think it will not be a switch off. I think it's going to be gradual. Probably, I mean, I don't know. I'm not in on these meetings, but I would imagine they'll do something like, they'll slowly ease it for the people that are less susceptible, in the sense that the younger population or people without comorbid issues, maybe the restrictions will be loosened, and maybe the 65 and up will stay quarantined or sheltered. I don't know how that'll go. Other countries, there's different approaches. We're all looking at China right now. Hard to really know what is really going on. I think we're all looking at South Korea as well. And then for our U.S., we're really looking at New York here to see what happens there, because they're our epicenter. And I think that's where we're going to get a lot of data from. And otherwise, I think Dr. Marty summed up everything. I think I'm just kind of adding to it, not to be a messenger of fright or fear, but I think that this is something we'll likely be dealing with for some time to come.
Thank you. Any specific updates from the hospital?
The hospital, we have, let me see, we've created a system with the county, with Dr. Marty and his team, where we've got like a stoplight system. We've got a green, yellow, and red system, and that sort of talks about that changes based on our saturation level. We have maintained a green, and so the hospital itself is prepared. So I think part of the easing of the restrictions has to be coordinated with the hospital, in the sense of what we can handle, what our capacity is, should we see a second surge. But otherwise, I think the hospital is doing well. Again, we've maintained a green operating status. We haven't met our saturation level or even moved into yellow yet. And we've got the PPE, we're trying to ration it. And yeah, we're looking at the long haul now, is what we're looking at.
Thank you. Any questions for the doctors?
Any questions for the two doctors?
Yes, through the chair. It seems that we do have a little bit higher incidence than our neighboring counties, but as it was pointed out, that has a lot more to do with a lot of our workforce working in Santa Clara. That seems to be kind of the pattern. And, we're talking about coming out of and reopening this, the state and the region. I think the key is probably advanced testing and getting the results a lot quicker through testing. If you're positive or negative for COVID-19. And now, has there been much discussion locally as far as how we could expand, the testing for this through would it be through the hospital or through local practitioners, or how, has there been any sort of planning for that? Either doctor could answer that, I guess.
I'll jump in, Dr. Bogie here. I'll jump in for the hospital's part. There are several FDA-approved tests now. We happen to have several of the machines in the hospital, and our rate-limiting factor has been us being able to get our hands on those particular test kits. So we've been slated to receive some of the Abbott test kits. We've got a machine. So I think as things go on, we will have access to more rapid testing. It's just a matter of that pipeline opening up and us being able to get our hands on the test kits for those machines.
Yeah, I'm sorry. yeah, I have some information that might be able to help us move a little bit quicker with that too. And I'll share it through Tracy, and she can get that information to you, Doctor, and see if it's worthwhile pursuing. I don't know, but I think Santa Clara is on it as well from a local source.
Sure. Sounds great.
Mr. Chair,
Yeah,
can
this
you put me
is
in line
Dr.
for
Marty.
comment, Ms. Jim?
Thank you, Supervisor Patello. Who's next?
Dr. Marty, I think.
Dr. Marty was speaking, but Jim, can you put me in line for a comment, Mr. Chair? This is Jim Gilio. Thank
Yes,
you.
go ahead, Jim.
This is
Go
Dr.
ahead,
Marty.
Dr. Marty.
I just wanted to support what Dr. Bowie was saying, and to reiterate again what I said about as we open up over time, and again doing that strategically and through good thought and trying to figure out again how we have the least impact on increasing our infections. But as far as testing goes, we've really depended on the hospitals. They've been great. Really stepped up to the line. Our private physicians have, for the most part, been sending people over to the hospital for testing. Not very many of them have jumped on board for getting tests, but we will need additional testing as we open up. As I said, we will definitely have to have additional testing, and we are anxiously awaiting those machines and the reagents and whatnot so that we can do larger batch testing, again, mostly through the hospital. Some people originally had tested in other locations in other counties, but we really need the access to additional testing, as you mentioned, locally, so that we can jump on any of these infections right away, and we can't afford to wait 7 days for a result to come back. And hopefully, with this new methodology, we will have testing in larger. We'll be able to do it in larger batches, and also the turnaround time will be very quickly.
And Dr. Vogie again, and being able to trace these infections as we open up these restrictions is going to be key. So, you know, where they've come from, who's infected, that's going to be a big part of reopening these restrictions. I think that's going to be just a super important part of this.
Absolutely.
Supervisor Gilio.
Thank you, Mr. Chair. So a couple of comments and maybe some questions for the doctors while we have them on the line so we can let them get back to work and doing what they do best, getting us out of this situation and treating everybody. Thank you guys for all your hard work. I know it's been countless hours and days and time that probably seems like a never-ending mission you guys are on, but I got to tell you, I sincerely appreciate it. And from what I hear and see in the community, we all appreciate you and the doctors, the nurses, custodians, everybody that's up working in the medical field. Thank you so much for your efforts and putting yourself in harm's way to help us. We really appreciate that. Some of the thoughts that I had on, when we open back up and how we open back up and how that looks as far as, going back to business as normal as possible. Like you said, I think there's definitely going to be a tiered approach. What I'd really like to see us do is work very, very closely with our neighbors to the west, Monterey County, and our neighbors to the north, Santa Clara County, and then even our neighbors to the east, Merced County, because we have, 85% of our workforce, roughly 85% of our workforce travels north to Santa Clara County, and obviously the other, 15, 20% travels west over to Monterey County, and there are a small percentage that goes over to Merced. But from Merced, what we see from the Merced County, Fresno County area, we have those folks travel into our county for work. It's kind of the way our local economy works and our pay structures and all of those things. So I really encourage the doctors, not only our Dr. Marty, our health officer, but also the hospitals to coordinate all this effort and work together, because if our reopening structure looks different than Monterey County, and if our reopening structure looks different than Santa Clara County, or Santa Clara County does something completely different and less restrictive or more restrictive, it could cause us problems with our infection rates here. So please do whatever we can to work together, and I encourage the county as well, Ray, Tracy, and everybody to work. And not that you're not doing that, I know you already are, but those close neighbors that we have are going to be critical. We need to open as a coalition and have the same visions, daily meetings, whatever that means. So I think that's important. I wanted to get your thoughts on that, and I appreciate your thoughts on maybe the staggered opening. And Tracy, thank you for your comments about the governor and him speaking this afternoon. I'm going to watch that very closely. What I get a lot in our community is because of the amount of uncertainty and the what's going to happen next, we're flattening this curve out. we really need to just be able to over communicate with our community. What does opening look like? When do we see it happening? I know there's no crystal ball and you guys can't tell us exactly when that's going to happen. Obviously, if you could, that would be great. But, I appreciate the message that you gave today about maybe a staggered opening, how that works, lessening the restrictions. But as soon as we can get more information out to the community about potentially when that may happen, what it's going to look like, I think it's going to help ease anxiety, because we're really fighting two things here, or probably more than two, but two big things. We're fighting the virus, obviously. We're also fighting, uncertainty, anxiety, an economic hit that is unprecedented. So anyways, I'll stop talking now, and if I can get your thoughts on those comments, I'd appreciate it.
This is Dr. Marty. Appreciate those comments, and we have an organization called ABAHO, Association of Bay Area Health Officials, and although it doesn't include Merced or Fresno, it does include all of the other counties. And as I mentioned, on Saturday, we had our first meeting on the phone with all of so Santa Clara, Monterey, Santa Cruz, San Francisco, all of the counties, and these are the health officers at this point, talking about how we begin opening up, and we will do it as a regional opening. So we will all do this in unison together and agree on this approach, whatever approach that is, and it will be a staggered approach. We will have certain sectors opening before other sectors. We are not going to be having large gatherings, obviously, and parades and sporting events and whatnot. That will probably be in the last to open, but we will come up with a unified approach. And as soon as we have that, and we all agree on that, then we will put that out to the public. But I can assure you that it will be a unified approach. And then we will add, and that's a good point, to talk to Fresno and Merced separately to make sure that they are also on board with us. So thank you for those comments, and we will do that.
Thank you. Supervisor Medina?
Yes, I just wanted to follow up with agreeing with what Jim has stated, but it's also imperative, extremely imperative, we involve the city of Hollister and the city of San Juan Bautista and Tres Pinos and everywhere, all the surrounding cities within San Benito County, and come up with a plan collectively, because the last thing we want is the message to be portrayed in different ways. So there has to be some type of a committee or some type of a dialogue with the two surrounding cities, being San Juan Bautista and the city of Hollister.
Thank you, Supervisor Medina. Supervisor Hernandez?
Yes, Mr. Chair. So my comments are parallel. So I don't want to be the dead horse. I mean, ultimately, I think when we think about what it means to open up, we also think about all the variables that apply. There's a lot of questions out there with the public as far as when they're going to be able to go back to work, and that uncertainty and that fear is creating obviously a lot of issues. And obviously understanding our small community and the resources that we have, which are very limited. I think we need to really have an involved conversation as far as the industries in our community and what it means to stage this, and even creating a support system to stage this so that we make sure that we're consistent across the board. In my mind, I mean, the ultimate outcome would mean that you'd have an engaged and responsive community, right? Because that obviously affects the impacts of the cases. So we have, and in my mind, what that also means, which it would be that we would have an involved conversation with not just health officials, but with our community. So we have a unified conversation. So we engage them and let them know what's going to happen. And maybe they can come up with solutions on how to create better outcomes, even within, as things have adapted with businesses and stuff. I know that they're more than willing to help. They just want to see what it means to keep their business from shutting down completely forever, which is, I know that's part of the conversation that's happening. Thank you, Mr. Chair.
Thank you. My comments, I've got a couple of comments and some questions. My first comment is that the mayor, Ignacio Velasquez, and myself attended a couple meetings yesterday I apologize. We actually went to a couple of businesses and visited their operations and their PPE system and we interacted with a lot of their employees, and it seems like the employers and employees themselves are asking for leadership direction from both the city and the county, because there was a lot of discussions about, is the mask mandatory or not? And I asked the employees, what's your opinion? And a lot of them says, our boss, the employers, they're asking for directions, because sometimes, these companies are, multi-million-dollar companies, and they're small companies compared to the bigger parent company, and they're just following directions from the bigger company, but they would love to get some type of leadership direction coming from the city and the county, and I honestly believe that having the mask as a mandatory, as what the mayor has said last couple of days, is very critical in light of us talking about how we can phase this out and start coming back to normal, which we all want. Every day we see businesses suffering. Every day we see the unemployment going up. That is very stressful. I had my son, who just got laid off last week. He's now part of that group, part of that 16 million members of our community who become unemployed, and I understand that. And where I work too, we're beginning to feel the bad situations, but it is what it is. We all have to sacrifice, and we have to contribute and help out, and for the doctors to talk about a phasing out and going back to a normal life, I 100% support it. However, we need to start taking some baby steps now, instead of wait, okay, well, maybe we're going to open it up, or maybe we're going to start, after May 3rd. I think we need to start implementing some tools, and the mayor was correct, and I'll say it, he was correct. I honestly believe we're going to start moving back and start opening it up. The mask would have been a good start. Unfortunately, we didn't do it. I get it. I'm on board. I am at the pleasure of the board, and I get my directions from the board, and I will follow the board's directions, absolutely. But I also believe that we should have done that. I don't know if that's still available. And then going back to the businesses, they're asking for directions. They're actually dying. They're asking us, give us directions, give us leadership. I did everything I can. I posted everything. Due to the coronavirus, you can't come into our office. All transactions should be in credit cards. Please do not step in our office. We'll work with you. Please wear a mask. We've done all that stuff. But there are other companies that have 200, 300, 400 employees that are asking for more information, more direction from San Benito County, from the City Hall, and specifically from the health department. And so I challenged our doctors to come and work together with the community on how we can do baby steps before we talk about opening it up. And that's my question and comments to the doctors.
Dr. Bogie, I'd like to comment about the mask. There's two different kinds of masks. There's one that's put on for vector control, and then there's one that I wear, an N95, to protect myself. The one that's put on for vector control is a surgical mask that we're asking that, like LA County, everybody's supposed to wear a mask. That mask is not to protect the person wearing the mask, it's to protect everybody else. So we've got silent carriers, we've got people that have been infected and just, have very mild symptoms. That mask stops them from spreading the germ from their mouth. So if they do a little cough or a little sneeze, it stops that from spreading out. I love that mask. I'm a big fan of that mask. My N95 mask that I wear at work is for my protection. That's so when I walk into a room and I see a patient that potentially has it, I'm not breathing in those germs. And so wearing that mask, it's a bummer. That N95 is not meant to be worn for 12 hours a day. But anyway, if there's some way I could help you spread the word and we could get the word about wearing a mask in public, I think that's a great start for sort of easing the restrictions. If we wore the masks, you have a lot of vector control. You have a lot of control of the spread of it. Now, Dr. Marty is probably more of an expert than I am. I'll leave him to comment more about it.
No, I totally agree. In fact, we've done a lot of outreach to the community about making these masks, wearing these masks, where to wear the mask. I did an interview on TV about the mask. So we went short of requiring them to wear them, but we heavily recommended that everybody that went out in public. Now, you don't have to wear a mask if you're just walking by yourself at nighttime or with your husband or wife for a walk in the middle of the evening when there's nobody around. But when you're interacting with people where perhaps social distancing is not the easiest thing to do, then we absolutely recommended a mask. So you're right. I mean, as we move towards doing anything to ease some of these restrictions, the masks are going to play a big part in that, because as Dr. Bogey said, that protects, when you wear a mask, you protect your neighbor. And when your neighbor wears a mask, they protect you. So I think that's going to be part of our lives for quite some time. But we can certainly push that information again out. And then as far as those businesses, I'm not aware of businesses, any other businesses. I'll defer to Tracy or to Darrell, and basically they can help us look into what the needs are of some of those businesses you were talking about. Thank you.
Thank you. I think before I open it up to the public, I think what we need to do, and I hope I get support on this from the board, I think we need to start having a task force committee, members of the public, businesses, because they're the ones that are getting hit the hardest. And some of the supervisors, and invite, like the mayor, like Supervisor Medina has said, both the city of San Juan and City Hauser and the health department, and start talking, start brainstorming ideas of how to start phasing that component out. We got to start having that meeting locally. I understand the doctor saying, they're part of the other group, but I think that we're unique. I'm afraid that, 22 out of the 38 cases, 22 out of the 38 are from Santa Clara County related to. I'm afraid that if we start implementing a phasing out program in San Benito County, and Santa Clara implements a different aspect of it, that it'll be kind of counterproductive. So I think that we need to work with our own group, our own shareholders, our business community, the construction, especially the grocery stores, because they're the ones out there in the battle line, and the medical arena, and your department, Tracy, and some of the elected officials in the City Hall, San Juan Bautista, start having these meetings now, and start talking about phasing it out. Because I'm sorry, but if a doctor in your department comes to us in a couple of weeks on May 3rd and say, okay, this is the phasing out period we want to do, I can't accept that. Somehow everyone needs to play the role and agree that we're going to do all these things, such as the mask, other options. How do we enforce to make sure that if we start laxing the social distance, you can start walking out, you can start doing all the things, and then all of a sudden the curve changes the other way around. I don't want that to happen. We've got to have a good plan.
Can I make a suggestion, Mr. Chair, on your idea? I think it's a great idea. We have the standing meeting in place with the cities and the county, the health department, and education. We can't forget them. We got a lot going on with education as well on Friday. And I think I don't think it's happening today. The governor is going to perhaps give some more guidance about the statewide order, because there is a statewide blanket order. And then obviously every county has a little bit different interpretation or restrictions on top of the state order. So perhaps we can get the governor's recommendations today, hear them. Our team can process those in the next 2 days. Then on Friday, we do have the meeting set up with the county, the cities, education, health, everybody. So perhaps we can, at that meeting, we can start working on a transition plan after they have some more information from the state.
We'll do that. Okay, thank you. Good idea, Supervisor Gilliam. We'll do that. Is there any objections from any of the other supervisors? No? Okay. Let me open it up to the public.
Dr. Bogey, anything you guys need from me, I'm happy to try to help you out.
Thank you, Doctor. We appreciate you being online with us. Thank you. Let me open. Can you guys?
Mr. Chairman?
Yes.
I hear what's being said about the mask, and I was somewhat educated just by the responses from the doctors as far as the different types of masks. And it certainly is a good idea to, do what you can to protect not only yourself, but anyone around you. But, I really do want to follow the health officials' recommendations, our health officials, as well as, what the state is doing. They have a lot more information and the science behind it. And that's what I kind of hope that we base our policies as far as best practices is off of the science. And what is being kind of more uniform throughout the region. And that's what we kind of should be watching for. So that's kind of my input. It's not that, we're trying, it has nothing to do with politics. It has everything to do with keeping the community safe.
I agree with you 100%, Supervisors, Jim.
Thank you, Supervisor Botello, because I think hold on,
Mr. Chair.
hold on, Supervisor Peter. We all agree with you, Supervisor Botello. Safety is the number one thing that we're concerned about right now. Supervisor Hernandez?
Yes, thank you, Mr. Chair. So I basically, my comments is just to in complete agreement, but reiterating the reality that rules are only matter when people follow them. And my biggest sentiment is, which is basically in agreement with you, Chair, it's a good idea to have stakeholder involvement and conversation, because I just, the rollout is really what's going to create the success element, meaning you're going to have the buy-in from the business community, from the residents, and ultimately you have some kind of an implementation process that isn't heavy-handed. And I appreciate what the city was trying to do. I just feel like there was things questionable or missing, because ultimately you had, just to tell people you have to do this is not as simple. And ultimately, how are you going to enforce it, especially when it comes to residents? So if there was a way for you to get the public to understand what the implications are, and then how they buy in is important. And right now, it seems to me that, and I talking to the mayor also, 80% of the community is all in with supporting, doing what's right to protect public safety. So you don't have to necessarily tell them you have to do this. Just letting them know and getting their engagement, I'm pretty sure they appreciate it. And because ultimately, I mean, you're going to have folks that aren't going to listen, even if we do write very strong regulations. And so my biggest point is that's why this has to be an involved conversation, because in that element, you're going to have a response because it's educated on their end and they're understanding the reality. And then ultimately you have a community that responds because it cares about each other, not just because it's being told to do something. And I think that's the best outcome we could have. That was the biggest struggle, because I see on Facebook there's a lot of frustration and anger. There's a lot of disconnect. I don't understand. I'm going into debt because of this stuff. Like, there's a lot of these questions and we're not really responding. And that's probably one of my big frustrations is it's not so much that we shouldn't do this. It's why aren't we telling them what is the game plan to help them resolve their issues when it comes to their unemployment or why their businesses are shut down, and what is the game plan for the county to help support, because it was basically induced. It was a government-induced shutdown, which basically means it was a government-induced shutdown of our economy. So those questions are real, and if we ignore them, we're by default basically accommodating that negative reality, which in my mind is my biggest point, Mr. Chair, is to create unity. And right now there's not that unity that I feel like should be there, that would create a better outcome and a better response from the public. Thank you, Mr. Chair.
Thank you, Supervisor Hernandez, and I think we all agree with you, and it takes time for the public to understand the new procedure. For example, because this is kind of like now in place for a little bit more than a month. People have, and for good reasons, and it's not intentional, but more it's a human nature for us to be social beings, the reality. And I saw it over the weekend during Easter break, and I'm not gonna say anything who it was, but I seen a lot of families that were getting together, having a good time, and social distance was compromised. And it's just the human nature for us to be with our loved ones, with our family, with our grandkids. And it's just, that barrier begins to break. And so we have to constantly remind the public, these are the things in place. And I appreciate Dave Westrick out there, telling the public through social media, we got to continue to do this. And the mayor through his Facebook videos. And we all play a big role in the community. We want to make sure that we do it. And again, I'll say it, Supervisor Medina said it perfectly. It's about time, or we need to continue to work together, that type of a relationship. And in fact, there was a poll done the other day. I was not going to bring it up, but I think it's relevant to what Supervisor Hernandez said. The public has no trust hired people solving the problem. The public trusts us locally solving the problem. They want us to solve the problem. And in fact, they even say that they have more confidence in the mayor of any city solving the problem than the president of the United States. It just tells you how the public interacts with our community. They look for us for guidance and directions. And so we need to step up to the plate and we need to start providing guidance and directions for the public. Ray, do you have?
If we're done with that, we do have one other item under COVID-19.
Yes, thank you, Tracy. Good presentation. Thank you, doctors. Good presentation.
It's Dr. Bogian. Can I just give a quick summary so everybody's on the same page? Maybe I'm wasting everybody's time. Do you guys mind?
No, go ahead.
So, I mean, I think it's sometimes we lose perspective of why are we doing all this. I think number one was that for the first time in over 100 years since the Spanish flu of 1918, certainly for the first time in any of our lives, we've seen something that could potentially shut down the healthcare network of our nation, which number one meant that if you shut that down, anybody that would need to come to the hospital wouldn't have access to healthcare if we were shut down with coronavirus. Number two, we were looking at a situation where we would have a lot of deaths in a short amount of time. I've heard the argument, oh, this is nothing worse than the flu. You know, if you look at the numbers over the last 4 weeks and the number of dead, whether that matches the flu or not, it's still the short amount of time that we've seen this death rate. So you had two problems here. You had one, we could have potentially shut down the entire healthcare network in the U.S., which would have shut off access to healthcare for everybody. Car accidents, strokes, heart attacks, any need for healthcare would have been we couldn't have met that with this pandemic. And then number two, we would have had just this massive amount of death unnecessarily in a short amount of time. And that was the goal of all of this sheltering in place, was to, slow that down so that we didn't shut down the healthcare system and so that we didn't have this massive surge of death over a short amount of time. I think what's going to end up happening is if we roll this out correctly, this coronavirus is going to be around at a low level, hopefully a manageable level, for quite some time. Hopefully we buy enough time that we can find a vaccination for it or a vaccine, or we can ride it out until it leaves. Anyway, that's kind of my take on it. And I think sometimes we lose perspective of the two big reasons why we were trying to do all this stuff. And number one, to not shut down the healthcare system. And number two, to stop the surge of death in a short amount of time. And I don't know if that helps, if everybody's thinking the same thing, but I sometimes forget too why we're doing it. And because you're in the moment so much that you forget about that. But I think that's a good message. If we can bring that message to people, they may understand it better.
Yeah, thank you, Dr. Bogie. This is Jim. Yeah, you don't lose sight of this. We got to get through it. We're going the right way. Let's not lose sight of where we're headed, and let's get through it together. Thank you for the comments, Dr. Bogie. That was pretty powerful about the amount of life that could be lost. Thank you.
Thank you, Doctor. Okay, we'll continue. Next part of the presentation.
Good morning, Chris Gangana with the Office of Emergency Services. Just wanted to give a brief update. The EOC is still activated at a level 2, which is partial activation. We participate in an EOC conference call twice a week, or we lead it, I should say, with the section chiefs and unit leaders. And then we participate in the City of Hollister's DOC call, as well as many Cal OES and then state EMS calls. So we're staying on top of all the communication, and again, waiting for the governor's big conference this afternoon that everybody has alluded to in many phone calls the past few days. We received a large order yesterday of PPE. We are expecting 2 large orders today. I did submit a request to the state on Friday for more PPE, and they came through. They called me Saturday and delivered yesterday morning. So that's been great that the program in place to receive supplies through the state resources is working. The masks we received yesterday were new, and so we are replenishing those that were damaged or old in the first delivery, and distributing them to all of the partners that have requested them, the hospital, fire, first responders, police, sheriff, etc. And then many nonprofits have asked for different supplies. So that's what we're doing.
Thank you.
Any questions?
Sure. Supervisor Medina? Supervisor Hernandez?
Nothing, Mr.
Thank you. Supervisor Botello?
It's good to hear that we're still continuing getting supplies. And has there been any request that we've been unable to meet at all?
Yeah, there's many items that we just can't get. Swabs are one of them for the hospital. They're on eternal back order. We have disinfectant wipes we're waiting for. We have several orders in with the state and with vendors that we're waiting on. And then Tyvek suits are hard to come by. We received some sizes that we requested. Some are just out of stock. But overall, masks have been plentiful.
Okay. And also one last question as far as personal protection gear. Is the private sector available to request these items as well?
No, these are for public, for government.
Private,
public,
besides healthcare?
correct, right. They're just for healthcare and first responders.
Okay. Thank you.
Thank you, Supervisor Botello. Supervisor Gilio?
I don't have a lot to add, Mr. Chair, other than to say thank you to Chris and her team and everybody that's working so hard to get these supplies out to everybody. Really, really appreciate it. Thank you.
Thank you. Okay, I'm going to open to the public. Do you have anyone from the public? No? Oh,
If you wish to make a public comment, please press *9 or raise your hand. Please state your name for the record, and you'll have 3 minutes to speak.
Thank you, Mr. Chair. This is Roland Resendez. Question for the doctor then. Are you saying that eventually everybody's going to have to wear a mask and it would be prudent to have people wearing masks in public places now rather than later? Not necessarily like going for a walk, like you said, but particularly in the stores to help protect employees and the members that need to go get their essential shopping done?
Dr. Bogey's still here. Probably Dr. Marty is. It's more his department. Do I think it's beneficial? I mean, I have no power to make an order for that. I think it would be a choice. Yeah, I think it's a good idea, especially going to a grocery store. It makes sense just to wear, I mean, even just a homemade mask is really all that would that's all you need. But yeah, it helps stop the spread of it. I think there's no doubt about that.
Thank you for your response.
any other speaker?
Susan, can you please state your name for the record?
Hi, Susan Logue, resident of Hollister. Thank you everyone for helping our community and being there for us. We really appreciate it. My own personal observation, I'm wearing a mask and gloves and have for a number of weeks now. Last week, it really seemed that the community was on board, and I saw many people when I do my shopping in the morning early with masks and gloves on. This week, less and less. So I'm wondering, I'm sure the community have to come together with some kind of plan. I've seen a big red stop, sign on the front of doors that says stop, so people actually look. And I don't know if it's possible to give away masks at every store. So when they go in the grocery store, they get a mask and maybe gloves. I mean, some people may not be able to even afford it or may not be understanding the severity of what we're going through right now. Thank you for your time, everyone.
Thank you, Susan. Anyone else?
Mm-hmm.
No other? Okay, thank you. We will close that. Okay, I'm gonna take a quick 5-minute break. On the other way. We do? Okay.
Yes, sir. Jim's here.
Thank you, Jim.
Jennifer, how do I set up the?
All right, we're gonna go to 2, CEO.
Peter here.
Thank you, Peter. Ray?
Yeah, I'll go ahead and open up while we get the computer set up. As everyone is aware, today was a scheduled budget discussion, special meeting that we had outlined at the beginning of the year, actually the ending of last year. And with COVID-19 occurring, it's kind of changed our normally scheduled outline that we have scheduled for April. But we did want to quickly give the board a highlight of COVID-19 and some of the impacts it's related to our budget, and discuss a timeline, a revised timeline with your board. So Stuart and I have been discussing this, and Stuart has a quick presentation for your board. Thanks, Stuart.
Good morning, Chairman and board members, members of the public. This is a quick presentation. I wanted to outline that the staff report has a lot more of the analysis information on there for anybody that wishes to review it. And if there are any questions on that, anyone is more than welcome to contact the administration office and ask for me directly. The impacts to COVID-19 have pushed back our budget timeline by about 3 weeks, and we're going to discuss that at the end here. But I wanted to highlight just some of the impacts that we're expecting to see in this next year on our revenues and taxes that the county generates. I don't think I need to harp on this too much more. I know that the doctors provided overview of the flattening of the curve and the social distancing measures that we're seeing, but we're seeing this across the nation and globally, which is going to have an impact directly to our economic activity. This next slide highlights the unemployment claims that we've seen. The rate at February was at an all-time low for February for the state of California at approximately 3.9%. Since then, we have seen a ramp up of unemployment claims at the EDD through these last few weeks, and we're expecting to see more of this. One of the projections that the UCLA Anderson School of Management has projected for unemployment by the end of the year is 6.3%. I wanted to highlight that in San Benito County, normally we see 1 to 3% higher than the state's average at our county, based on the demographic and where we are situated in the county or in the state. The next slide just highlights what we saw during the last recession, and I am not stating that we will see the same. We see a lot of differences from the last recession to now. One thing is the economy was going well before we had to place restrictions, the social distancing restrictions. So we actually are going into a potential recession in a high point. But we just wanted to outline kind of what the worst could potentially be. Not necessarily that this will happen. Our total revenues saw our most dramatic decline in 9/10. Generally, counties and cities see major reductions 1 year removed from the initial recession starting point. This one was in 2007-08, and you can see that in 08-09 we were still status quo, still seeing increases. Mainly that is because of property taxes. Property taxes are based on the first of the year valuations. So we're not projected to see any potential decreases if we see changes to the real estate market and valuations there until 21-22. And we will not see that in the 2021 budget year. Additionally, this was the effect on the general fund. During the Great Recession, we saw the sharpest decline of 13% in tax revenues, or total revenues to our general fund. And just to give additional perspective, it took 7 years for the county to return to those pre-recession revenue levels. At this time, it does not look like it's going to be as bad, but again, this is changing daily, and we can just project kind of based on what we're seeing in the coming months based on these social distancing measures.
Hey, Stuart, I got a quick question for you. I've seen the graphs, and it seems like they're all consistent. You got the drop 08-09, and then it takes a while just to reach to the 08-09, and then it starts moving up.
It took 7 years during the Great Recession to get back to our pre-recession levels.
Two-part question. First one is that based on real dollars adjusted for inflation every year moving, away from 8-9?
I did not adjust these for inflation. These are actuals that we did see.
Issue. It's not a big difference. And then the other one is that because we're now picking up What's your opinion? I don't want to say anything else, but just that. What's your opinion? The higher it goes up, the harder it drops?
Not necessarily. Obviously for the county, the big draw for us is the property tax. That's where we see most of our revenues. I'm going to explain that in a few slides. This recession has not been sparked by the real estate market, and I'll discuss that a little bit more on another slide. But in the 2000 recession and the previous recession before that in the early 90s, we actually didn't see market values decrease. They kind of planed off, and then there was a quicker return back to normal levels. So I'm just kind of reiterating a worst case scenario so that we're aware and prepared. But it does not look like it at this time that we're going to see the same effect that we did during the Great Recession.
Okay. Thank you.
So obviously there's no easy models. There's not a lot of data out there for a pandemic related recession. So we're trying to make our projections based off of how long the social distancing will last. We worked with HDL, who provided us additional information on our sales tax revenues. But their projection is based off of a May 30th lifting of social distancing. Obviously, they've put in factors of not going completely back to normal, but we will be continuing to monitor and having to change our projections dependent upon the outcomes of the pandemic. Additionally, we are expecting that we will have to bring some sort of mid-year adjustment to the board for fiscal year 2021, just because we just don't know what the outcome is going to be. So in my staff report, there is a table. It outlines a little bit more information on the assumptions and analysis that have gone into these estimates for next year. But these are the main general fund revenue sources for our general taxes. Again, you can see that we're still expecting that we will have an increase to property tax revenue. This can change based on potential delinquencies, but the valuation is going to hold because it's based on January 2020 valuation. That is going to be coming out over the next few months from the assessor's office. If we saw decreases to market values, to real estate values, we would actually see that in the 21-22 year when the assessor's office does their readjustments January of 2021. We are expecting a decrease in our sales tax revenues just based on the economic activity that we're seeing. Additionally, transient occupancy tax, we don't have a lot of hotel and TOT activity in the unincorporated area. We saw a spike in 18-19, but I believe that was mainly due to some audits that were completed by the auditor's office. We, again, not quite sure where that's going to land based on the lifting of any social distancing measures. So we just wanted to highlight some of the main revenue sources to general fund and where we're initially projecting to be at this time. Obviously, we might have changes in the next few months to the end of the next year. So this graph, I just wanted to highlight, and this is kind of goes back to what the chairman was discussing on, are we going to see a V-shaped recession, a U-shaped recession? How is this going to play out? So this is the grayed bars are representative of the last three major recessions that the United States saw. Obviously, and this is the home price index from S&P, which just basically measures the home price values. And obviously, we saw that it took multiple years for us to get back to those pre-recession values during the Great Recession, during the dot-com bust, and the energy crisis in the early '90s. We didn't see as much of that dip. And at this point, we're not expecting a dip. We're not preparing for a dip in our property tax values at this time. So that will be subject to change. The main concern for the county here is that delinquencies and the waiving of penalties and interest. The county runs on a teeter. They do the teeter plan. So the county upfronts 100% of the taxes, even if we don't receive 100% of the taxes to the other agencies. And the county is basically on the hook for coming up with that difference of the delinquencies. So that's something that we're discussing with the auditor's office, and we're going to be closely monitoring over the next year. This next slide is the revised budget timeline. When administration has been pulled into response to COVID greatly, we have had to reallocate some of our resources to help with the tracking of expenditures that we're going to be taking to requesting reimbursement from FEMA and other duties and functions that we've had to deal with. The big change that I made first was I allowed the departments till April 10th, which was this last Friday, to get their budgets in. Due to administration being taken away from working on the budget, we have not finalized a lot of the department requested budgets. There's still some additional things that are going to be worked on this week, and we're going to try to get that wrapped up and finalized. Again, we are going to have to kind of change the way that we were approaching this new budget year. Initially, we were expecting additional growth. We were expecting to add some more positions and do some other things. We're going to be taking a cautious approach to that and look more towards our fiscal sustainability going into a potential longer-term recession, especially not knowing the outcome of this. The CAO Ray Espinoza and myself discussed that we would like to push out the budget hearings to August after the July break, and we will bring the recommended budget for the Board of Supervisors. This will be mostly a status quo budget. We do have obviously a lot of contracts that have already had potential increases, normal COLA increases and items like that. Additionally, we're going to be including our new revenue projections, but for the most part, we're expecting to bring to the board a recommended budget that is more status quo of the previous year, and that, if approved by the Board of Supervisors through the resolutions that we bring on the 16th of June, that will be the spending authority until we have the budget hearings in August and we bring the final adopted to the board for final approval and adoption in September. If anything changes in our emergency situation, we do have the ability to roll over the final budget from the preceding year, which would be fiscal year 1920, as the beginning spending authority until a budget is adopted. We are hoping that we are not going to need to ask the board for being able to do this. We're hoping that we are going to be able to get that recommended budget to your board by June as the spending authority.
Mr. Chairman,
Yes.
I'm sorry, here I am, sorry. Anyhow, has there been any thought, I don't know, Ray or Stuart, on, and maybe this is unpopular with my colleagues, having the budget hearings in July, where it doesn't seem like anybody's going on vacation, and would that be something that would be better than waiting till August?
So,
It's
Mr.
just an idea going out, and
I think, Mr. Chair, if I may, this is Jim. One of the things that I'm really interested in, Supervisor, before we hit the budget, is what the state's going to do with all our subvention funds and how that's going to look like. And that's why I would be in favor of kind of seeing what they do, depending on when their timing comes down. But that's just some feedback that I was thinking about right now as well.
Mr. Durame.
Yes, Ray?
Yeah, and that's kind of one of the discussions that Stuart and I had is really understanding what's happening with the feds and the state. They're obviously in the CAO's conversations that we've had throughout the state. There are going to be some revisions and some changes, and they're anticipating in June. So it gives us some time to react to that and document in July, and then have it in August. If there is a change, we could have a special meeting in July as well. But I think at this point, we kind of wanted to see what the state's doing, and actually even see what's happening with COVID as well, because I think that's really important. It gives us some time to react to that.
I will support the staff's recommendation to wait till August. I think timing actually might be our best ally in this situation. Let me pull the board. Actually, that's a good question. Supervisor Medina, how you feel? Should we have it in August?
Yes.
Thank you. Supervisor Hernandez?
Yes, Mr. Chair. Right now, there's a big delay when it comes to the response, and it's just because the system's been so overwhelmed with even like the FFCRA, Family First Coronavirus Response Act, and the CARES Act. So long and short, I think it puts us in a better position to understand what the outcome is.
Okay, then let's keep it as recommended by the staff, right? You may continue.
And don't get me wrong, Mr. Chairman. I was just throwing that out there as an idea, but I certainly could see where we, given more time, where understand if we're truly in a recession or just kind of a blip of economic times, but and how it affects San Diego County may be quite a bit different than our experience in the past. So, it was just an idea.
No, truly worth noting it. It's just that, unfortunately, because of the situation, actually timing is probably our best ally on this one. Yeah. Thank you, Supervisor Botello. Good point. We'll agree with your guys' recommendation. We agree.
Thank you, Chairman and Board. And that concludes my presentation here. Obviously, administration is looking at this closely. This has kind of pushed back our ability to get more information to you at this time. But we're hoping that next month we're going to have another special meeting. I will have more information for you. We'll be closer. We'll have some recommendation for expenditure with the recommended budget, and we'll have some more information at that time.
Okay, thank you. Let me ask if the board has questions. Supervisor Botello?
No question.
Thank you. Supervisor Gilliam?
No, sir. Thank you.
Thank you. Supervisor Hernandez?
No, Mr. Chair, but I did want to make some comments, but if you wanted, I could reserve those for after. I don't know if we have another item that we wanted to discuss.
No, that's it. This is it.
Okay. So I just want to make sure within the context of this, if I may, Mr. Chair, basically, after, there's been a lot of homework that's been done from obviously county staff. I know Supervisor Gill has been really involved trying to understand the economic impact. I had a conversation with him. So I just wanted to share a quick update. We talked about certain things, that the implications of all these, the shelters in place. And so as it pertains to San Benito County, I know that there's a lot of questions with which the business community has is how do we bounce back from this? You know, at what point in time when the shelter-in-place gets lifted, what is going to be our ability basically to get back on track? And so I just wanted to remind, you know, and for the public, if they didn't kind of understand the rollout, I mean, the FFCRA was the first one that was rolled out on March 18th, and it was enacted it was signed by the president, enacted by Congress, and it was called the Families First Coronavirus Response Act. That was basically focused around ultimately getting people to just stay at home, to shelter in place, especially if you had symptoms, if you were sick. And so there was obviously unemployment insurance rolled out, even tax benefits, tax incentives for businesses that had to lay off employees, or to a certain extent, if they wanted to keep their employees, that's what the payroll protection program was enacted for. So, but it's kind of funny because ultimately the shelter in place, all it became was more the payroll protection program really didn't become very, very practical for all intents and purposes in San Benito County, especially because ultimately you need full-time employees, and in San Benito County, when you're dealing with the shelter in place for like the restaurant and hospitality industry, you have folks that are pretty much working part-time. So therefore, with the unemployment insurance benefit, especially the $600 extension, more than likely they're going to be staying home instead of being out and work and putting themselves at risk. For all, obviously it makes sense. And then the CARES Act, which was enacted March 27th, that one allocated $350 billion, and it included small loan packages for the business community. The hard part is because the system was so overwhelmed that they basically the funding didn't get really rolled out, or it hasn't rolled out just yet. They even, I think, included in that package 1,000 new loan officers, and it still wasn't enough. I've been having really engaged conversations with a Small Business Development Center, and then also with Cindy Mirzon from Small Business Development Center, and also Mark from the EDC about this, and it seems like there's a consensus that that ultimately the rollout of all these stimulus bills really hasn't been effective at responding to the impacts to our business community. So all that said and done, there's a lot of questions right now, and so the business committee would like to know, and actually it's in line with what you were sharing earlier, Mr. Chair, and how do we have a stakeholder type of conversation? And I think it'd be prudent. One of the things that came out was the RLF fund, the revolving loan fund, which county staff, Dulce Alonso, our management analyst, has been working hard to get answers on what that would mean to support funds for our local business community. So it's right now, it's basically the homework is being done to figure out if we can benefit from that. And I'd like to see if we can add that as an agenda item for the 21st, Mr. Chair. If anybody, if our CAO would like to add to that, I'd appreciate his comments also.
I'll just add a few words. I know that that we've been working on that, looking at potential programs, and just trying to look at other avenues that we can move forward with in our county for especially the small business, rural businesses. I can tell you throughout the state, everybody is in the same situation. And a lot of other counterparts are looking at options that they can implement to assist with that. So I know that there's housing assistance programs, CDBG grants, and other types of funding that other jurisdictions are looking at. So those are the things that we're as well looking at that and trying to ramp up internally for this gap until the businesses start opening up here in the future. So we'd be more than willing to put that on. We'd be more than willing to put that on the agenda next meeting.
Okay. Yes, Supervisor Hernandez.
I forgot to add, I apologize, and sorry, Ray, but yeah, I was basically forgot to mention that right now as we speak, and I know at the county, we rolled out a survey, and I appreciate them, what they rolled out. It actually gave us a good idea, but I think if anything, it gave us a good idea on getting a little bit more clarity from the business community as far as the impacts. So the chamber, and I believe they're coordinating with the EDC, another survey, and they have a list of businesses, of the updated business list that was provided by the county. And that basically is going to have a lot more of an intent to really engage with our local business community, especially those that were non-essential, and ultimately find out what is the impact and what are the resources that you need right now to make sure that we prevent any closures of businesses, and I know that, you know, with the ordinance that was enacted, where we delayed basically evictions. We didn't allow for evictions to happen. That still pretty much deferred out debt. It didn't necessarily help with debt, and so businesses, to a certain extent, all they're doing is basically accruing debt, which might put them in a stronger position to have to shut down if they can't get caught up. So all that being considered, that's why this survey is going to be really, really important, and I think it'll add to the conversation of the stakeholder group to know really, really what the impacts are for San Diego County, and give us a better opportunity to see how the county could possibly respond and help with those issues. Those are my comments, Mr. Chair.
Thank you, Supervisor Hernandez. We will put it on a future agenda item. Thank you. Supervisor Medina, I think so. Yeah, Supervisor Medina.
Nothing.
Thank you. All right, let me open up to the public then. Do you have any speaker cards or members of the public?
If anyone wishes to speak from the public, please press *9 or raise your hand.
None? No comments? Okay, thank you. Now we go to closed session. Barbara? Ray, you want to say something?
The first item on closed
Second, aye. All those in favor say aye.
Aye.
Against, motion carries. Thank you. Meeting is adjourned.
Okay, thank you.
Yes, ma'am. Do I need to sign anything? Oh, I love that.
Tell me who, I think it was Peter,
Anthony
Anthony,
and Mark.
Mark,
Mark went too.